regards to how obesity is defined, there really is currently a lack of consensus on the best way to define obesity. However, as most of us know, most of our healthcare providers are going to use body mass index, which is looking at height and body weight. So BMI is the prominent measurement used in our healthcare system, and a BMI of greater than or equal to 30 kilograms per meter squared would be what we would define as obesity. And again, BMI is based on height and weight and does not take into account that body composition component. And so if someone has more muscle mass, their BMI may be higher than you would expect. They may actually be considered overweight than if we actually looked at percent body fat. So percent body fat is another way to determine obesity, and the American Association of Clinical Endocrinology really recommends the use of the World Health Organization thresholds, which is 25%, greater than 25% in men and greater than 35% in women. Now, the last one that I want to talk about is really waist circumference. So waist circumference has also been used as an indicator of visceral adiposity or central adiposity or abdominal obesity. And the World Health Organization recommends those waist circumference thresholds of greater than 102 centimeters or 35 inches, as most of us would be able to understand that. And that's in men, and greater than 88 centimeters or 40 inches in women. And so again, this is really a surrogate of that visceral fat or adiposity. And I just want to say that it also should be noted that there are differences in BMI and waist circumference cutoffs for different ethnicities. And so that's also important, that we have to remember that we're not all the same, and that there will be differences depending on race and ethnicities, and something that has to be considered as well when we're thinking about how obesity is defined.